Hello, and welcome to the Paramedics and Social Prescribing Information Webinar. I'm Neil Dreimer, Director of the Health Innovation Programs at Healthcare Excellence Canada, and I'm pleased to be one of your co-hosts today alongside my colleague, Sarah Oliver. Before we get started, I'm going to go through some of the technical components to ensure all of you joining us from across the country have what you need online for a positive experience. Please note that this session is being recorded. We are pleased to offer French simultaneous interpretation provided by Karine Rosbach Communications for this session. If you wish to hear the voice of the interpreter, please select French from the interpretation menu at the bottom of your screen. If you do not see the interpretation menu on your screen, please select the 3 dots More menu and select Interpretation. We invite you to share your questions and comments throughout the webinar today using our chat box in either French or English, and we encourage you to respond to comments and also even answer questions as you feel able in the chat as you wish as we go along. And if you need any support during this webinar, you can reach out to our tech support using the direct chat feature. So with that, I would like to start by acknowledging that we are meeting on land that has been inhabited by Indigenous peoples since the beginning. In particular, we acknowledge that we are broadcasting this webinar from Ottawa, which is the traditional and unceded and unsurrendered territory of the Algonquin people. We recognize and deeply appreciate their historic connection to this place and the opportunity to gather here today. I would also invite you to introduce yourself in the chat and let us know the lands from where you are joining from today. And thank you to my HEC colleagues in the background who are adding the native land website in the chat if you would like to learn more about the territory you are joining from. So during today's discussion, we'll dive deeper and spend most of our time focusing on HEC's new Paramedics and Social Prescribing, or PASP for short. I'm just getting used to that abbreviation, which is now part of our Care Forward program. But before we talk about PASP, I would just briefly like to share, and if you attended last week's launch webinar, provide a brief recap about Care Forward. So what is Care Forward? Well, I want you to imagine a future where everyone receives the right healthcare at the right time in the right place, where more people can age at home with dignity, and long-term care is compassionate and tailored for those who need it, where the health workforce is supported and leading the way forward. That's why we're inviting you to join Care Forward, a pan-Canadian movement of people making healthcare better, faster, by sharing knowledge and applying proven approaches. With support from HEC and many supporting organizations across the country, through funding, resources, expert coaching, and peer networking, healthcare change makers like you can help drive lasting local impact and improve care for at least 1 million people across the country, across these 4 priorities that you see on the slide. PASP is part of the 4 new offerings that will all move toward expanding care to improve access and ease pressure on emergency departments. To allow us to achieve these ambitious goals, HEC has launched a new application system. We'll give you a quick sneak peek of this later on in the webinar. And as you start to embark on applying for PASP or any of our other offerings. If you have any questions or suggestions for improvement, please don't hesitate to reach out to us. So I wanted to also share that the work around improving access to care and easing pressure on the emergency departments is guided by 4 key policy pathways to help reduce avoidable emergency department visits. You can see those on the screen here, but we know that these are working and have the ability to work, supporting community-based health promotion and disease prevention, expanding access to primary care, enhancing appropriate care through service integration and innovation models, and of course, strengthening the healthcare workforce. So as I just mentioned, Care Forward has 4 new offerings. PASP teams may also be interested in the Right Care Challenge. This is a 12-month offering with resources and financial award opportunities to teams who are launching or enhancing solutions to expand access to care and reducing pressure on emergency departments, rewarding their success and sharing the learnings with others who could apply them too. Our second offering is enhancing integrated care, which is a 12-month offering that will bring together up to 100 primary and community care organizations together. The primary care access improvement offering is an 18-month program that will support 25 team-based primary care organizations to implement contemporary advanced access. And I wanted to mention that more information about all of these can be found in the chat. But we know the reason why you're all here today. It's to learn more about paramedics and social prescribing, which is our new 18-month offering to support paramedic services to improve, further embed, and systematize social prescribing in their service models. The goal of this offering is to provide space for teams to focus on optimizing social prescribing within their service by bringing people together to share knowledge and experiences. We will go into more detail about PASP shortly, but now it's my pleasure to introduce our speakers for the rest of the session. We're so pleased to have the Canadian Institute for Social Prescribing, which is anchored by the Canadian Red Cross, working in a collaborative capacity with Healthcare Excellence Canada to support the development and implementation of the Paramedics and Social Prescribing offering, providing thought partnership, training support, and subject matter expertise. Joining us today from the Canadian Institute for Social Prescribing, we have Safia Clark-Mendez, who is the Education and Learning Specialist at CISP. Safia supports the development and advancement of education for the social prescribing ecosystem through training and curriculum development. We also have Srija Biswas, who is the project manager at CISP, providing overall management and support for the network development and convening of partnered initiatives, social prescribing, training development, knowledge development and mobilization, and advocacy. From the paramedics world, we're really excited to have, Dr. Alan Batt, who is an associate professor of paramedicine at Monash University, the paramedicine program lead, an assistant professor at Queen's University, and an assistant professor at the University of Toronto. Alan's research uses mixed methods approaches to explore health professions education with a focus on professional competencies, care of marginalized populations, and social and structural determinants of health. From our team here at HEC, we have my colleague Sarah Ulver, who many of you on the call already know. Sarah is a senior program lead and will be leading the Paramedics and Social Prescribing offering. So we're really excited to have them all join today. And I'm now going to turn it over to Safia and Srija, who will get us started. Over to you.
Thank you, Neil, for that wonderful introduction, and I absolutely appreciate the context that you have set. And we're very, very excited to be here, and we're really looking forward to see how this project unfolds. So I will just jump right in. Next slide, please. I wanted to start off with a little bit of introduction as to how we look at social prescribing and how we define social prescribing. And social prescribing, very simply, is a way to connect the formal healthcare system and the non-medical supports that address the social and structural determinants of our health. Conceptually, this is not new to you, and it's something our health and social care sector is very familiar with. Connecting patients with non-clinical supports has been happening informally for years. But what social prescribing can do is it can provide a common lexicon and a common framework. So we can really elevate the importance of this type of connecting collaborative works, and we can enhance its reach and impact overall, whether this impact is on individual health, on communities, or on health systems. I also wanted to share a definition here with you, and this is a globally accepted definition, which positions social prescribing as a collaborative pathway between health and social care through co-creation with patients and supported connection to non-medical prescriptions that can impact health and well-being. And while these collaborative pathways are really there to cater to unique contexts and unique needs, depending on where it's situated, there are a number of core principles that acts as the pillars for social prescribing, and I really wanted to share a couple of those with you. So first of all, social prescribing is an intentional collaboration between health and social care, practitioners, and individuals, which creates a more integrated system. It also prioritizes and enables a person's ability to determine their own goals and really to take control of their own well-being in a supported pathway by asking what matters to you and co-creating the solution with that individual, with that client, to really reflect their needs. And social prescribing is also very much evidence informed, and it approaches health in a very holistic way. And the success of social prescribing is really founded on strong relations and collaboration between providers, communities, and individuals. Next slide, please. Thank you. I also wanted to share with you how social prescribing happens in practice, and this is a social prescribing pathway. So the social prescribing pathway always begins with an individual or a family who is experiencing some non-medical barriers to health, who may be disconnected from the support that they need, but also have unique strengths and unique gifts and goals. And their interaction with the health system then becomes their point of entry into social prescribing. A lot of the time, this point of entry or the doorway is healthcare providers or primary care providers, because a lot of the time we do go to our primary care providers with our health-related needs, even if it's a non-clinical need. But that doesn't mean that social prescribing has to start with a healthcare provider, and any door can be the right door. We have seen a lot of social prescribing pathways starting with allied healthcare professionals like nurses, emergency response professionals and paramedics, pharmacists, and even other secondary care providers as well. So once the individual is identified with a non-clinical need that is affecting their health, in a social prescribing pathway, what we do is we intend to get them referred to a community connector or a navigator. They're often called link workers as well. And the role of navigator is really, really important in this pathway because they are the personalized point of contact with that individual and the care system. And they use active listening to focus on what matters to that person and co-produce goals and solutions with that individual. They also provide supportive access to culturally appropriate resources, and they also help them address barriers and advocate for clients' needs. They journey along with the person to make sure that they're well supported, they're connecting to the right programs. If there's facing any barriers, they are always there to support addressing those barriers as well. And they really are there to empower the the client, the individual, so they can take greater control of their own health. And so when the individual exits the pathway, they are resilient and they are able to manage their own health and well-being in a sustainable way. So the one of the important part of social prescribing pathway is the participation part. So once the link worker identifies the non-clinical need, they support the client into participating in these programs. And this program participation can really be anything depending on what that client needs. Someone who finds value in arts will be prescribed to something that is arts-based. Someone who values nature, they have prescriptions that really caters to that. Everything that really reflects the individual interest of that individual. And another important part of social prescribing is while the link worker is journeying along with the individual, they're also observing the impact of these participations on this person's health and well-being. And in a very mature form of social prescribing, there are ways to really gather these impacts and feed it back to the point of entry, which is whether that is healthcare providers or the allied healthcare professionals. So I will pause there and then I'll pass it over to my colleague Safia, who will be giving you an overview of what's happening across Canada. Social prescribing is really getting a lot of traction across Canada, and she'll share a little bit about that. So over to you, Safia.
Thank you, Srija. Next slide, please. Thank you. So this is a snapshot of what social prescribing looks like across Canada and the different initiatives that are involved. And there are a lot of commonalities in the pathway and the core components of how social prescribing is implemented, as Srija would have pointed out through the pathway. But we also see different models in different regions to accommodate for each province's unique health and social care infrastructure and community needs. So in some parts of the country, social prescribing initiatives are led by the healthcare system, and some are more community-driven, but cross-sectoral collaboration and person-centered care are at the forefront of both. I'm just going to give you a very quick rapid-fire picture of what it looks like in a few of the provinces. So social prescribing in Canada has gained a lot of momentum. Oh, sorry, just going back to the previous slide. Has gained a lot of momentum. In Ontario, it started with the RX community pilot in 2018. Social prescribing was implemented in 11 community health centers. And since then, provinces have taken unique paths to making social prescribing their own. In BC, United Way is expanding the network of community connectors, aiming for over 100 community connectors this year. In Alberta, the focus is on supporting older adults, and social prescribing has been implemented in 13 communities with over 2,500 social prescriptions made so far. In Saskatchewan and Manitoba, they're collaborating across sectors to connect seniors to community resources through senior resource coordinators. And in Quebec, they're building the evidence for social prescribing and have started innovative pilots such as those connecting folks to arts and culture in their community. And in Newfoundland and Labrador, link workers are helping to reduce social isolation, even in remote areas. And finally, in Nova Scotia, they're exploring an approach to social prescribing that builds on years of community-based care through wellness navigators. So you can see these efforts show that social prescribing in Canada is moving forward through community leadership and collaboration. And next slide, please. Thank you. So social prescribing is really transforming how we think about healthcare by focusing on what truly matters to a person's well-being, as Srija would have pointed out. Principally, how social prescribing helps is by addressing the social determinants of health, like housing, food, and social connections. So issues that can't be addressed by clinical care alone. Social prescribing through connecting folks to community resources can strengthen social ties, reduce isolation, and build a person's sense of belonging. This can support mental health as well as physical health by connecting folks to resources that can promote physical activity as well as, again, community connection. And it's been shown among older adults, social prescribing by connecting folks to these resources can prevent cognitive decline. And then from the healthcare perspective, this work advances team-based integrated care, so emphasizing collaboration between health and social services, so folks aren't working in silos, and this has also been shown to improve job satisfaction. And ultimately, social prescribing can help reduce pressure and costs to the healthcare system by focusing on preventative care rather than only intervention. An analysis of the potential benefits of social prescribing to the healthcare system found that every dollar invested into social prescribing programs may return $4.43 to society through improved well-being and reduced costs incurred by the health system and the government. So I will pass it over to Srija to tell you a little bit about the work that we do at CIS.
Thanks, Zaf. And next slide, please. Thank you. Before we wrap up, we really wanted to just showcase the work that we have had the opportunity to do with our partners. So as you can see, social prescribing is being implemented across Canada on a provincial level, lots of emerging conversations. So Canadian Institute for Social Prescribing is positioned to really convene these conversations, to be the national hub, so we can bring together the movement that is happening across Canada and accelerate that movement to support these movements. And we do this in for specific ways. So first of all, we are here to connect and convene. We support the network in the network development, convening conversations to make sure there is no silo in the conversations. We are also focused on developing knowledge and raising knowledge and awareness about social prescribing, and also building capacity through training and education, and a lot of the work that Safia is really leading. Evidence is really important in social prescribing, and we are here to support that. We are actively working together with researchers and evaluators from across the country to build out evidence on the impact of social prescribing and to understand the process of social prescribing. And last but not least, policy is really important. We are here to advocate for social prescribing and support in community engagement and advocacy engagement across the country to make sure that social prescribing is really gaining the momentum it needs and really moving forward with the way it needs to be. So that's all from us. On my next slide, I have some information. So if you want to connect with us or have any questions for us for after, I just wanted to share that with you. So over to you, Neil.
All right. Well, thank you so much for that. And Alan, if you are ready, perfect. I'll hand it over to you.
For sure. Thanks, Sarah. And thanks for that, Srija and Sophia. It's a great overview of social prescribing. And I think, the opportunity to collaborate with CISP and the Canadian Red Cross on this was a great opportunity for us to utilize that expertise within Canada to help strengthen this program. So this is going to be a really exciting program to look at. So we can just move to the next slide, please. I've only two things to say about this really that add to what Sophia and Srija have shared with us, and that's really around you're already doing this. Paramedic services across Canada are doing social prescribing. If you're not familiar with this diagram, the original version of it is in a paper that describes the roles of paramedics in Canada. This is a paper that's actually under review at the moment, this current version of it, and it's looking at the role of community paramedics. But really, it comes down to this role that all paramedics in Canada are playing, which is the health and social advocate role. And so we've structured a lot of our work in paramedicine over the last few years around these roles. So clinician, team member, health social advocate, professional or reflective practitioner, and an educator. Within that health and social advocate role, if you read the original research by Dr. Walter Tavares and colleagues, they talk about system navigation. And so when we say system navigation, we're really touching on what is pieces of social prescribing. We're helping people to find the resources that they need. Those might be clinical, but often they're not clinical. And their referral to social services or linking them in with people that might be better positioned to support their needs. So what we really did with this paper that's under review at the moment, and I can share a link in the chat shortly to a preprint of this, so you're welcome to have a read of it and give us feedback on it, is that we tried to really systematize and formalize this role of social prescribing. So this isn't just about community paramedics, but one thing that we noticed from our research in this area was that community paramedics seem to do this a bit more than paramedics in a frontline 911 capacity. And that's largely because of the ability to spend time and to get to know patients on a more routine basis. But it's not to suggest that social prescribing is only the remit of community paramedics. And in fact, we would encourage services to apply that are not bringing forward community paramedic programs, because again, the value is in reaching people in the community, and it doesn't have to be just through community paramedic programs where they exist. So it's really to say that you're already doing this. We know that the workload of paramedics is not often dominated by acute emergencies. We do have a lot of interaction with people who have unresolved social needs that lead to healthcare issues. Paramedics do a good job, I think, of figuring this out. And from working with paramedics in various countries and all across Canada, paramedics are good at figuring this piece out. But it is problematic when we don't use the same language as other professionals and when we don't formalize it in our education. So this Paramedics and Social Prescribing program is really designed to do that. And then the second thing I'm going to say on the next slide, please, is that this works. And so, we've seen these programs launching across Canada, telling people not to call 911, to, keep 911 for emergencies only. The reality is that some people will call because they have a perceived emergency or somebody isn't actually able to manage their need. And so social prescribing does work. And so when we talked about that social navigator role, just on the previous slide, we were really talking about the ability for paramedics to either be that social prescriber, so be the actual person who acts as the link worker or the navigator within the system, or refer to people who already exist within the system. And these are good examples from other jurisdictions where this has worked. So in the West Midlands, for example, in the UK, this is a non-paramedic based social prescribing piece, but it's with the Council for Voluntary Services, and they linked in with the West Midlands Ambulance Service. And their social prescribing piece that had paramedics just basically refer people to link workers resulted in a significant drop in ambulance calls to the West Midlands Ambulance Service and a significant drop in conveying people to the emergency department, along with quite significant savings in the system. This was mirrored in Northern Ireland with Northern Ireland Ambulance Service only last year, the year before, where again a 50% reduction in ambulance calls, a significant reduction in conveyance to the ED, huge savings from a monetary perspective within the system. And it's not just about the monetary savings to the emergency departments or anything like that. We're reducing our ambulance workload. We are reducing the admissions to emergency departments, therefore taking some of that volume away that's causing offload delays, for example. We're reducing inpatient admissions, so we're freeing up some beds to allow for better flow through the system. And then there's also been evidence from here in Ontario alone that social prescribing has reduced repeat 911 calls already over in the county of Simcoe. And so really what this is about is, and I think one of the biggest opportunities here with this program is to address the needs of frequent service users or users who are perhaps commonly in a position where their needs are unmet by existing 911 services. And so the two things to remember here are you're already doing it in some capacity. It's about formalizing this and systematizing it and actually taking ownership of pieces of this as a system for paramedicine. And number two, it works. It reduces the amount of calls you'll get. It reduces the amount of people you have to transfer to the emergency department, and it saves money. And I think if we focus on those two big impacts, then we should be looking at success at the end of this program in the future. And so I'll pass it over to Sarah now, and thank you for your time.
Fantastic. Thanks, Alan, for grounding us in reminding us of the great and impactful work that folks are already doing and how this program will hopefully support that. So as Neil mentioned, Paramedics and Social Prescribing is a new 18-month offering to support paramedic services improve, further embed, and systematize social prescribing into their service model. All paramedic services from across Canada who are interested in improving their use of social prescribing to connect participants with local community services are eligible to apply to PASP. Whether you're just starting out or you're perfecting a gap in your system, please do consider applying. PASP is looking to invite in about 30 teams, and the definition of team is quite flexible. It can be an individual paramedic service, a service partnered with a community organization, or a service with multiple sites and partners with a common goal. As Alan and Safia have mentioned, fantastic social prescribing work is already being done by paramedics across Canada. And to support knowledge sharing in this offering and more broadly, we've created the Promising Practice Guide that will pop into the chat right now. In joining PASP, we will help teams understand and action the steps highlighted in the promising practices, learning from their peers, and creating new learnings as they address their own gaps. As participating teams can receive up to $30,000 in seed funding to support their work. They also receive monthly group coaching calls and virtual and in-person learning experience that foster peer connection and more. PASP aims to improve the overall health and well-being of participants, improve both relationships with and experience of link workers or community partners you would prescribe to, improve paramedic provider experience, and ultimately to reduce unnecessary ED visits where there is an ED available. We will have teams track and report on these in various ways. So the applications have just opened, as you will have seen, and they close on June 27th. From there, we'll do an internal review of applications and aim to notify applicants by the end of July. We do want to flag that we're really hopeful to have a contract signed from teams by the end of August, which we know is going to be a tight turnaround with summer holidays, but it's going to allow us to jump right into content in September. So once selected teams do join the program, we will have a very packed 18 months of learning, testing, and implementing of the social prescribing pathway. We're going to start with monthly hour-long webinars in September to tackle topics that we'll get into in the next slide, as well as direct you towards any available supports and tools in these topics. Also in September, we begin our monthly hour-long coaching hubs. These will be an opportunity to come together in small peer groups for expert coaching on applying what you're learning in the webinars and learn from others who are doing similar work. We'll have an in-person learning event on November 19th and 20th in Toronto. HEC will support all of the associated costs of one member of each team to join. This is going to be an opportunity for rapid learning and to meet other teams and coaches on this work. Teams will be required to submit 3 deliverables. They'll also be required to submit data on a quarterly basis in support of the previously listed aims, and they'll need to submit 2 very simple annual and expenditure reports in March of each year. We're looking to broadly share any new tools or learnings that come from this work, as we've already done with the CPNAT, which has been discussed in the chat, and the Promising Practices Guide. We'll keep posting and sharing them online for those outside of this offering. And after the project, we expect to be able to share things and learnings more broadly. During our learning events, we'll walk teams through every step of the social prescribing pathway and all of its supports. While this is not an exhaustive list, some of the highlights include the use of the Community Paramedic Needs Assessment tool, how to create and maintain a community asset map, building and maintaining relationships with community organizations you refer to, creating a referral pathway, culturally safer care, change management, and so much more. This is a very high-level overview of the offering, and now I'll hand it back to Neil to lead us through some Q&A time.
Thanks so much, Sarah, and hopefully my Zoom difficulties are behind me. And thanks also to Alan, Srija, and Safia for sharing that. So I'll invite everyone to please continue to chat in questions that you may have for our speakers, who I'll also now invite to turn on their cameras. And we'll look to field those questions. So I already see a few questions have come in through the chat. They've been answered, but just so that everybody sees them. One of the questions came in just wondering if applicants should be submitting the Community Paramedics Needs Assessment tool with their applications. Sarah, do you want to just verbalize that one?
So you're very welcome if you've already completed it, but you don't need to. That's going to be completed as part of the program.
Okay. And the another question that's come in, if my service doesn't have access to a link worker or a navigator in my community, can I still apply? Sarah?
Yes, absolutely. Please do. So for PASP, paramedics can either refer to a navigator or a link worker as part of their program, or act as the link worker or navigator. So we see that there will be two likely streams of paramedics, those who have the link workers in their community that they'll be referring to, or those who will be taking on a bit of that role themselves. And we'll support both within this program.
Okay, great. Again, please continue to chat in your questions. Alan, maybe you can answer this one, and I'm sure you can link to it too. Can you share the preprint link you mentioned, please?
Yes, I did that, and like I said, that paper is under review, but the content in it is you're free to use it, and if it's helpful in any way, then we're happy to provide like copies of the images and stuff that are used in it. But I guess to summarize it, really, it was a case of taking all of the existing descriptions of community paramedicine in Canada and trying to figure out, do those fit in the existing roles or not? And it turns out they do. Which is great for us as a profession because it means our role descriptions work even in these highly specialized contexts. And so I've shared a link in the chat, but I'll share it again as a separate message, and would love to get feedback on it if anybody has thoughts.
Okay, thank you. And yeah, no, that's going to be a wonderful resource once it's available or fully published. I see another question that's come in, and I know Danielle has maybe partially answered that, but I might be interpreting it in two different ways. What will the evaluation team be looking for? Just wondering what we can do to make us one of the successful 30 applicants. So there's two things there. One is, what will HEC be looking at in terms of people that apply? And so I can start this one, and maybe Sarah can expand on it. And then there's also, from an evaluation perspective, what are we expecting for teams who join? So in terms of what we want to see for in applications, well, we do want a paramedic service to lead the application with the community, ideally with a partner organization based in the community. That's definitely, whether it's occurred already or if there is plans to do so. We want to see, we understand that different teams across the country will maybe at different stages of where readiness and implementation in terms of social prescribing. As has already been mentioned, we expect that some services are already doing this, even if they don't call it social prescribing. But we know that others might be looking to start doing it more formally. So we want to have a clear sense that that will be doable during the time frame of the program. I don't know, Sarah, if you want to add anything else in terms of what we might be looking for in terms of applicants.
No, I think that was a great summary, Neil.
Okay. And then just more in terms of the evaluation, if that was what you were looking at, HEC will be looking for teams who can report aggregate data on one of two data collection options, either a brief patient survey or pulling administrative data on the number of emergency department visits for those people in the community who are receiving social prescribing. So thanks, Danielle, for that. All right, I'm seeing more questions come in. What types I do you foresee being included in the $30,000 of funding available? So I think, Sarah, I'll probably turn to you in a second. But for the seed funding can support, and it's included in the application, the call for applications, what's permitted. It could be to offset some of the time for team members to participate in some of the learning sessions, like the webinars, the coaching sessions, things like that. Sometimes they might need it for some time-limited resources to support implementation. Of course, we know that this is not meant to replace sustainability plans for any social prescribing approaches within the paramedic service. This is to help get you started and to support really showing that this works. But Sarah, I don't know if you want to add anything else?
Yeah, I think that's exactly right. And if your project is specifically trying to enhance a particular part of your service, you could look at creatively using those funds. So, for example, if you wanted to temporarily use the money to hire somebody to create your community asset map that your system will continue to maintain, that's one way you can use the funds. If you would like an additional person to come to the in-person training, you can use your funds in that way. If you're looking at integrating a new indicator into your EMR, we can look at, could you leverage the funds in that capacity to pay for that indicator being added? Lots of different ways that you can do it to use that funding to get you started in on or help develop a specific part of the social prescribing pathway.
Great. Thank you. So I see a few questions here around slides being shared. And so if you registered for the webinar, either today or previous Care Forward webinars, they will be shared, I believe, in the days to come. So look for that. And I'm just reading through a few others. I manage a program for shared health, which oversees 4 healthcare zones. Each have different needs. Can multiple applications be made to highlight the needs in the different areas? I think I know the answer to that. So yes, you can apply if it represents different geographic regions or sites or different needs. Sarah, anything you want to add around that one?
Yeah, we welcome you to apply as your services need. So if you need to apply in as four different health zones, then that's okay. I would just note we have room for about 30 teams. So do keep that in mind. If your health zone is many teams, just be aware that sometimes grouping them could be more advantageous. But we also acknowledge that those 4 zones might have very different needs and might need to come in as different teams.
Yeah, no, that's a good point. And I see another question. We are a large family health team and are a small primary care based embedded team. Are we able to apply? So as we mentioned before, in order to apply, it needs to be a paramedic service that's leading the application. They can partner with other organizations, including community-based organizations, but the application needs to be led through by a paramedic service, because we are focusing on paramedics and social prescribing in this one. I don't know if I know there's other people looking or chatting in. Oh, and so maybe I'll ask Sophia or Srija if you want to talk about this question a little bit more. What is the role of the community partner in this? Do you want to talk through that a little bit more in terms of social prescribing, and then we could perhaps add in relation to the paramedics and social prescribing offering.
Yeah, I absolutely love this question. Thanks for bringing this up. And how we, and please, Sarah and Neil, pitch in how you look at it from a paramedic's perspective. Community organizations, our community partners are really the connection with the supports and services that are in the community. So they are the one who can connect you with the prescriptions that you can, when you identify someone with a non-clinical need, the prescriptions itself are situated within the communities, and that's the role the community partners can really play in this connection, in this pathway. And Safia, is there anything else you want to add to that?
No, I think that about covers it. Yeah.
Thanks. And Sarah, would you want to talk through anything more around in our particular program, the role of community partners?
Yeah, so I think, as Sarija said, the community partners are essential for this work because they're going to be providing the services, whether they're the community partner that's acting as the link worker who's then referring to broader community services, or if the paramedic is referring to those community services that are providing the social supports. They are an essential partner in the health and well-being care of the participant. And so one of the things that this program will be supporting is the referral pathway. So creating how do they get to the community partners, and how do you work with the community partners? Ideally, this will be a project between the community partners and the paramedic services so that there is honest and easy flow between the two based on the participants' needs, and easy access to both, culturally appropriate access to both. So hopefully it'll be a tight partnership. And the link worker, I just see that this is a follow-up question. A link worker is like the system navigator, or sorry, Sarija, I think that you're asking if you want to take that question. I'm just seeing multiple things come into the chat at me all at once. So sorry about that, folks. But I'll hand that back over to you.
No, I think you have exactly answered who is a link worker. And Safi, we had a slide on that as well. So link worker is really someone who, and it can be anybody. It could be a social worker, it could be a navigator, it could be a coordinator. It's really someone who has the understanding, who has the ability to, or intention to sit with a client and understand their needs, and then also has knowledge of what's in the community, whether that is having access to a navigation tool, or they just know about the programs. They have understanding of what's in the community, and they can be that bridge. They can understand the client's need, create a tool or a plan for that client, and then simultaneously connect them with the resources that are in the community. And I think in the social prescribing pathway, link worker plays a really, really important role because they act as the bridge. They act as the they to some extent journey along with the person, really to make sure that they're well supported and connected.
Thanks, Sarija. Great answer. I'm seeing more questions come in and trying to navigate. So speaking of navigation, I see one. I'm a current patient navigator who is already doing social prescribing that is labeled as patient system navigation with a paramedic service. So that's great. Should we be proposing advancing this offering, or better to focus on optimizing and formalizing the prescribing I'm already doing? That's a great question. I mean, it sounds like you're already doing the work. So I can't answer the question for you. I think it is. I would encourage you to work with the service that you're working to maybe consider applying. I think, as Sarah mentioned, whether you're just starting or already doing social prescribing within a service, I think the opportunity exists to further advance it, optimize it. I think as people start to work in the program, there'll be opportunities, particularly with coaches that are, we're lucky to have many of the speakers and other folks on the call like Cheryl Cameron, who are going to be, who's a paramedic and a great resource, who will be able to provide coaching and guidance to those teams who are participating. So I can't really say whether you should be advancing the offering or optimizing, but formalizing it within the service is a big part of what we're hoping teams will be doing. All right, I see another maybe more technical question, which I think we have time for maybe a couple more minutes of questions. And I think we'll also include, if it's not already included, an email address to follow up if there's more questions that come up or we don't get to them. But I follow the link to the HEC portal to fill out the application. However, I'm receiving a message that I must be affiliated with an approved organization. Do I have to wait to see if my service is approved before applying? Sarah?
So that's just a new feature on our application system. It's not an approval system, it's just a validation system. So it's making sure that we have your organization's information correct for any contracting. It should take 24 hours and then be confirmed, and you will be able to go in and apply. So it's just a quick confirmation and validation of your organization, and then you'll be able to continue your application. So sorry about that step.
Yeah, it's a new system, so we're just figuring it out. And maybe this will be the last question for the webinar. The community paramedic is doing the role of linking. No, sorry, if the community paramedic is doing the role of linking, they would be potentially referring to many different community supports. So who is it that you partner with in that case on the application? So I could make an attempt at answering this. It doesn't have to be just one organization. I think you can decide who you might want to deepen your relationships with. But of course, in the true sense, social prescribing would not just be necessarily with one community organization. So you can decide if there's ones that you might want to prioritize during the time frame of the program. It doesn't have to be just one organization, but I would suggest it might be a good idea to have conversations with some of those community organizations before applying, so that you could see level of interest and things like that. Sarah or anyone else wants to add?
Alan, can I pass that to you for any
Yeah,
addition?
sure. Thanks, Sarah. I think it's a great question, Heather. I would encourage paramedic services to think about this in a broad perspective. That, if you're not quite sure what the program is going to look like yet because you're awaiting the results of the CP-NAT assessment or something like that, then partnering with broad community services, I think, is a great idea. So like pharmacists have a big role in social prescribing that's often underutilized. Older adult centers, for example, municipalities often have community support kind of offices that you could link in with. And so, like Neil said, I think some people working in these spaces already in paramedicine have good connections with multiple different community organizations. Linking in with a few of those would be good, but there's also an opportunity here to look at those connections that we don't have established very well. And I think pharmacists is a great example. And there's actually an upcoming webinar on paramedic, the role of pharmacists in social prescribing too. That there's opportunities there for us to work with each other to strengthen some of these pieces. So I would say go broad and cast a wide net and try and establish some new relationships if you can. But I think Neil's advice on it doesn't have to be one organization is the key piece there.
Thanks so much, Alan, and thank everyone, all of our excellent speakers today. We're not signing off just yet, and we will be sharing slides. And again, we included a link to if people have more questions, but we will be showing a brief video about the new application system momentarily. But before we do that, again, I want to thank everyone for joining. hopefully what you found an excellent and engaging session. We hope you found it informative and will join us in improving health outcomes care experience for patients and providers and the value and equity of care nationwide. Once again, I want to thank all of our presenters and thank all of you for joining us today. So to wrap up, we have a 6-minute video that walks through how to create a new account in HEC's community portal and access the program management platform to apply for PASP or any other HEC offering. So we'll be doing that now.
Welcome to HEC's Community Portal, a secure space where you can apply to and manage your participation in HEC offerings. Let's get started by setting up your account. This will ensure you stay up to date on the latest offerings. As a first step, select Get Started and then Sign Up Now. You'll be prompted to enter and verify your email address. Once you receive the verification code via email, enter the code into the form to complete your registration. From there, you can complete your user profile and you're ready to go. From the homepage of the Community Portal, you can explore HEC's current offerings and learning opportunities. To apply or register for an offering, select Enter Here to access HEC's program management platform directly from the portal. Here, you can view and submit applications for active HEC offerings, invite others to collaborate on your application, and manage reporting, including progress and financial reports. On the home page, you'll find a list of active HEC offerings, key program details, important dates, and eligibility requirements. You'll also find helpful guidance on how to navigate the platform and access the information needed. To get started, click on Apply Now in the left-hand menu. From the Apply Now page, click on the application button for the offering you're interested in. Then complete the appropriate application to register or apply to participate. It's important to remember that the portal does not auto-save. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application and return to it later, as long as it is submitted before the application deadline. To support the completion of your application, you can invite a team member to collaborate. When completing the team member information, check the box labeled Invite Team Member to Collaborate on this submission. They'll receive an email notification and be granted access to work with you on the application. The email will include a link for your team member to create a user profile in the HEC Community Portal to access the application in the Program Management platform. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. After all required information has been submitted, the team lead will receive an email notifying them that their application has been submitted. If HEC staff need more information about your application, the team lead will receive an email outlining what's required. You'll be invited to log in to the program management platform to make edits or provide the additional details requested. The team lead will be notified of the outcome of their application via email after the review process. If your application is successful, you'll be enrolled in the offering. Each offering comes with an established reporting schedule for all participating organizations. To submit a report, go to the Report section in the left-hand menu, then click on Due. Here, you can view your upcoming reports and submit the required data. You can also view previously submitted reports under the Submitted section. If you're enrolled in the Challenge offering, you may be eligible to apply for awards. To apply, go to the Admitted or Awarded section, select your active enrollment, and look for the available award option. If an award is currently open, click the Submit button to complete and send in your award application. Once submitted, the team lead will be notified of the outcome and any next steps following HEC's review. Now that we've walked through the HEC Community Portal and the Program Management Platform, here are a few key reminders to keep in mind. It's important to remember that the portal does not autosave. Be sure to regularly click Save or Save and Close at the bottom right corner to avoid losing your work. You can save your application at any time and return to it later, as long as it's submitted before the application deadline. When your application is complete and you're ready to submit, the Submit button will appear, but only after you've saved and closed the form. Keep in mind, once submitted, you'll no longer be able to make changes to your application. To view all applications you're collaborating on, select All from the drop-down menu at the top left of the screen. If at any time you need help with the application process, be sure to check out our frequently asked questions and call for applications documents. These resources include valuable details like eligibility requirements, important dates, and guidance to support a successful application.
So that's all. If you stayed till the end, thank you so much and have a great day. And if there's any questions, please reach out, as we mentioned, through the email and the chat box. Thanks again.